to Sinovac.
That's right. And are we still expecting 600,000 doses from Sinovac? And will the shipments still be arriving on February 23? That is just in 2 days, or a day. Tomorrow, actually.
Sean, we're still expecting. Sean, we're still expecting around 600,000 doses of Sinovac from China. These are donations from the Chinese government. 100,000 of those will be used to military personnel. But then we're also expecting some delays. It won't arrive on February 23. Secretary Roque, during his press briefing earlier, explained that since the EUA has been approved by the FDA only today, the Chinese government expressed to the national government that they need 3 to 5 days before the delivery of the Sinovac. And upon arrival, the national government also needs a day to prepare before the inoculation to those who will be part of the priority list.
All right, and what did presidential spokesman Roque have to say about the contested efficacy of Sinovac's vaccine?
Well, Secretary Roque defends the efficacy of Sinovac from China. He mentioned that despite the fact that the efficacy rate is only at 50.4% based on the study of Brazil, the World Health Organization still approves the usage of Sinovac. So he feels that it's still safe to use Sinovac. And when asked if he's willing to be the first one to be vaccinated using Sinovac, he said he's very much willing to use it. But then we also asked Secretary Roque if President Duterte will also be part of those who will be first to be inoculated by Sinovac. Well, Secretary Roque said that unfortunately, the FDA is discouraging the usage of Sinovac to senior citizens. And President Duterte, being a senior citizen, won't be part of the priorities for the use of Sinovac.
That's right, Mase. Now, if we can recall, this indemnification agreement is what caused a delay of the delivery of Pfizer's vaccine. Are we having same problems with Sinovac? Are they also asking for an indemnification clause or agreement with the national government?
Well, Sean, Secretary Roque said that this is not part of the conditions given by Sinovac. It means that Sinovac is not asking for any indemnification agreement from the national government. He, however, clarified that since we're still waiting for the passage of the indemnification bill anytime soon, once signed into law, the indemnification bill will cover all vaccine brands and Sinovac.
All right, moving on now to Russia's Gamaleya Sputnik vaccine. How is the country's negotiation going with Russia for these vaccines?
Our Philippine ambassador to Russia said earlier that there is an active discussion between the Philippine embassy and the Russian government about the purchase of Gamaleya, or the purchase of Sputnik V, the vaccine from Russia. But I understand that we're still waiting for additional documents for the final approval of this. He was also asked if there's a move from the Philippine government to ask for donation from Russia. But then our ambassador said that he did not initiate, or we did not initiate to ask for donations because he did not receive any instruction from Malacanang to ask for it. The national government is very clear in saying that we are willing to pay for the doses of Sputnik.
All right, let's move on to another issue. Has the president decided on the suggestion of the Education Department to resume limited face-to-face classes in low-risk areas?
Yes, Sean. Secretary Roque announced earlier that President Duterte has decided that he is rejecting the recommendation of the Education Department for face-to-face classes, even for pilot testing. He mentioned that he is concerned with the number of cases, especially now that there's about 62 new variants listed in the country, and so there's a need for data analysis. Maybe, Secretary Roque, the President will consider face-to-face classes sometime in probably on August this year, once we already started implementing our vaccine program.
And speaking of course, the pandemic, which has been almost a year in place, when do we expect the president to decide on the proposed nationwide MGCQ come next month? We have less than a month to go before March comes. Less than a week, sorry.
Sean, this afternoon, all cabinet members will be meeting with the president. Secretary Roque said that probably one of the agenda is about the placing the National Capital Region or the whole country under modified general community quarantine. Of course, we all know that the IATF has approved the idea of placing the entire country under MGCQ. But then again, President Duterte still have to look into the data analysis submitted by the experts, and then after that he will make a decision. Unfortunately, the president won't be having any public address tonight, so we will be waiting for his decision maybe on Wednesday, or if Secretary Roque was instructed to announce whatever the decision of the president prior to that wait, well, we'll just wait and see.
All right, thank you so much for all your insights and your time, Maricel Halili, joining us live from Mandaluyong City. And now to give us insights on the emergency use approval of Sinovac's shot, we have Dr. Lulu Bravo of the Philippine Foundation for Vaccination joining us over the phone. Good afternoon, Dr. Bravo. What are the implications of skipping medical frontliners as the first in line to receive vaccines and move on to other demographics?
Yes, thank you very much, Sean. There was this EUA issued just this morning that Sinovac can be given to our actually frontliners, but not to health frontliners. It will have to be given to those who are not in the health, who are actually at highest risk of being exposed to COVID. I think it is because they're really limiting it to make sure that those who are at highest risk from being exposed to COVID are perhaps given a vaccine that could have a higher efficacy, having known that the vaccine has only 50% efficacy for health frontliners. But remember that this vaccine has a good efficacy as much as 85% for those who are in the other age group, like 18 to 59 years old, and are not at the highest risk of COVID. So I guess that is what the vaccine expert panel and our experts have come together, and they did their main recommendation. And to me, it is an important recommendation that we should follow. We do need to realize that it doesn't take just one person to do this recommendation. It takes a lot of our experts to make sure that the benefits of any vaccine will outweigh the risk.
That's right, Doc. But don't you think because it's not approved for medical frontliners that this would actually exacerbate vaccine hesitancy, or at least justify those who are hesitant against receiving the vaccine, which is, of course, counterintuitive to the inoculation drive?
Well, not necessarily. If you actually understand, as I said, what benefits mean outweighing the risk. Because from the clinical studies that have been published and that have been shown to our vaccine expert panel, it just shows that there is less efficacy for those who are at highest risk, those who are constantly being bombarded, so sure. And the efficacy here is 50%. They said what's shown in Brazil, right? But it doesn't mean that you cannot give it. As you can see, we are having a pandemic. Everyone can actually make use of a vaccine because having some protection is always better than nothing at all.
All right.
So this is how we will do it. If you do nothing, if you don't give vaccination, it will actually be difficult for us to also be able to control the pandemic. And the more that we can give vaccine to our people, the more that we can manage.
All right, Doc, moving on now to indemnification issues. What's your position on these issues, and what are the implications of Sinovac not necessarily asking for this indemnification agreement?
Okay, I'm not very keen on the indemnification because I am a doctor. I am looking at the efficacy, the safety of vaccine, and the rollout are actually under the privy of the negotiators and how it will come to us. What I am thinking about is different companies will have their different requirements. I guess this is what we need to know, that the control for the supply is not in us. I mean, in the Philippines, it is the control on the manufacturers. And what they require will be their own thinking. I don't think, we can really do anything about this. If this is what they want or this is what they're asking. So to me, there is really a chance for us to try and look at the data, see if this vaccine is good for us. If it is good for the people who need it, then it could be given. But what we need to realize is supply is very much limited. There is a very high demand for all these vaccines. And as long as you are able to examine, investigate the safety, the efficacy, and the experts are coming together to see what we need to actually analyze, then we should really trust these experts.
All right, thank you. On that note, we've run out of time. Thank you so much for your insights and your time. We appreciate it. Dr. Lulu Bravo, Executive Director of the Philippine Foundation for Vaccination. Let's take a look now at other vaccine updates from across the globe. Australia has kicked off its mass inoculation program with vaccines from Pfizer and BioNTech. Prime Minister Scott Morrison received the first dose of the vaccine on Monday. Some 4 million Australians are expected to be vaccinated by March. Japan will slow down its vaccination drive for the elderly in the next few months due to limited supply. Japanese officials said they will not be receiving additional supplies from Pfizer until May. As countries think of ways to stretch scarce vaccine supply, a recent Israeli study showed that the first dose of Pfizer could already protect against the virus rather than the standard 2 doses. And Bloomberg reports that Pfizer's vaccine stopped 89.4% of COVID-19 transmission in Israel. The Israeli study, which has yet to be peer-reviewed, is said to be the first real-world sign that vaccination could curb the spread of COVID-19. Israel started its mass immunization program on December 20. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. I'm Sean Yao, and we are One News.